Exactly. I'm sorry for that. Good afternoon. And maybe you have people joining from elsewhere. So good morning, good afternoon, and good evening, perhaps.
Okay. Before Prof. Hanan will tell us about the AMR situation in the global level, also needs to be done to tackle AMR. I will introduce Prof. Hanan. Prof. Hanan as Assistant Director General for AMR in WHO, based on Geneva, Prof. Prof. Hanan, the floor is yours, Prof. Do you hear me, Prof. Hanan?
Good morning. Yes, good afternoon. Yes, I do hear you
Yeah.
very well. Am I
Okay.
clear as well?
Yeah. Yeah. You
Okay.
can start, Prof. Hanan.
Okay, good afternoon, everybody, and thank you very much for having me part of this event. And I would also like to reflect and thank the government of Indonesia for having a very successful side event on AMR a few months back. As everybody knows, I'll just give a short briefing and then perhaps if there's any specific questions. But antimicrobial resistance, as you all know, is really a phenomena. It's more of a phenomena than of a specific disease. And the issues that allow for the rise of antimicrobial resistance, where common pathogens like bacteria and viruses no longer respond to common treatments and available treatments, is because of the overuse and the exposure of these pathogens to the medications, whether intentionally through treatment that is inappropriate, or through the food chain, or through the environment, where people are unaware.
Recording in progress.
Unaware of being exposed to antibiotics. Now, the solutions for antimicrobial resistance requires significant health system strengthening in the human and animal sector, and also good practices within the environment, water, and other industries. So it's really closer to a climate change phenomena than a specific disease that will be eradicated. A lot of solutions need to be put in place. And I think that there's the quadripartite. When we were present with you all in Bali, we had presented the different work that we are doing within our specific sectors. And there's very solidified now joint work that we are doing with the 3 other organizations and with many stakeholders and partners. The flip, and I'll add maybe 1 or 2 points, the flip to antimicrobial resistance that we also need to tackle and pay attention to is the lack of access to effective and affordable antibiotics in many parts of the world, specifically in the low mid-income countries. So even though people are dying because the treatment that we have are ineffective, some of the effective treatments are not reaching the patients in the right time. And that can only be solved by strengthening, again, a universal health coverage, making diagnostics and therapeutics affordable and accessible to communities around the world. So maybe I'll stop here, and I'm happy to answer any specific questions if you wish.
Okay, thank you, Prof. Hanan. And the next speaker, we will hear from Dr. Anis Karuniawati, PhD. He is a chair of Antimicrobial Resistance Control Committee, and will present it about the AMR situation in Indonesia, and then also post-COVID-19, what we need to retain and stop to tackle AMR. Mrs. Anis, the floor is yours.
Thank you very much. Can I have the access to share my screen? I want to present some slides.
You can use the access.
Not yet.
Already, Mrs. Anis.
So I have sent the slide to Ibu Frida as well. So maybe you can also share this.
Okay.
Bu Anis, please check.
Okay. Yeah. So can you see my slide?
Yeah.
Yeah. Okay, thank you very much. Thank you for this opportunity. In the first session, I will show you the AMR situation in Indonesia. So apologize that some of the data is actually not really new and need to be renewed. So the first one is the data about the household with antibiotic storage. This is from the National Health Survey in 2013. So among the household who store the drugs, 86% among the population, and 28% of them store the antibiotics. So of course, this is how they got this antibiotic can be from different ways. So from the previous prescription, or they can also got it from their neighbor or from their relatives. And this is the, so as we know that in Ministry of Health, there is an indicator for rational use of antibiotics. And two indicators of this RUM is the use of antibiotic in two diagnoses in the primary care: acute respiratory infectious non-pneumonia and diarrhea non-specific. And we have already decided the target in 2024 should be less than or same as 20%. And for the diarrhea, the use of antibiotic should be less than 8%. And this is the result from the 2010 until 2014, it is still above 40, also for the diarrhea non-specific. But so we didn't have any data from 2015 until 19 because the Ministry of Health changed their indicator. And then again in 2020 and 2021, it is still until the first semester, it is already decreased to 20%. So we hope that in 2024, it will be less than 20%. But in the diarrhea non-specific, as we see here, that between 2020 and 2021, June, it is still above 10%. So we still have to work hard to decrease this. And how about the data in hospital? So we have only data in 2016, which is done by the Committee of the Antimicrobial Resistant Control. We collect the data from 6 hospitals. This is actually province referral hospitals. And then we try to evaluate using Giessen criteria. And I want to emphasize here the criteria 5 means that this is both in the pediatric wards and the internal medicine. And criteria 5 means there is no indication of antibiotic use. And the label here show the lowest percentage and the highest. So between 24 until 56%, the use of antibiotic in pediatric wards is without indication. Whereas in internal medicine, between 33 until 48%, the use of antibiotic is without indication. And the next is about the data of antimicrobial resistance. So this show you the resistance or the percentage of the resistance among some bacteria pathogen. important pathogen which is prevalence, high prevalence in Indonesia. So GLASS or Global Laboratory Antimicrobial Surveillance System is coordinated by WHO, and we Indonesia involved in this surveillance activity, and this is all the sentinel site, yeah, and all of the sentinel sites should report their data to NCC. This is the Badan Litbangkes, the NIHRD, and then both NRL, PBLK Surabaya and Jakarta responsible for the quality of the result. And this is all the 20 hospital which until now integrated the data into the NCC. And I show you here the resistance of top 3 pathogens.
Hello. Freezing. Dr. Anis. Dr. Anis, hello. Can you hear us? Okay, okay. Now we can hear from the third speaker for this afternoon, Dr. Kalsum Komaryani. She is Director for Health Service Quality from Ministry of Health.
I don't hear anymore, so I don't know if it's just me or...
Oh. Sorry, Prof. I think some technical problem issue. Okay, we will start the third speaker. We have in this room Dr. Kalsum Komaryani. She is Director for Health Services Quality from Ministry of Health. Dr. Yani, the floor is yours.
Thank you. Good afternoon, ladies and gentlemen. When Indonesia assumed the G20 presidency in 2022 with the theme Recover Together, Recover Stronger, we agreed that it is important for us to end this COVID-19 pandemic and to ensure that we will recover collectively and strongly, leaving no one behind. We also agree that during our G20 presidency, we should focus to be better prepared for future health crises. AMR is a global and growing health issue. Sadly, AMR is called silent pandemic because
so I'm very sorry, I lost my signal. Is it?
Sorry. Yes, AMR is called...
Sorry, Prof. You can hear us or no? I think Prof. Hanan cannot hear. Sorry, Prof. Wait a moment, Prof.
Sorry. Can you hear me, Prof. Hanan?
Yes, yes,
Yeah.
now it is clear.
Yeah.
Thank you very much. It is clear
Yes.
now.
Yes. Let me continue. AMR is called silent pandemic because it has not been discussed like other pandemics, and now much of the progress made in the global effort to tackle AMR is being disrupted by the COVID-19 pandemic. We need to reverse this trend, and G20 is the most appropriate international forum to offer solutions to this problem. To define the best way to tackle the AMR, we have organized the AMR side event titled Tackling Antimicrobial Resistance curbing the silent AMR pandemic. The key objective of the AMR side event is to strengthen and sustain AMR prevention and control implementation. Ladies and gentlemen, allow me now to share the sequence of AMR side event leading up to the outcome document of G20 call to action on AMR. We held the first pre-event on May 23, 2022 in a virtual format. The first pre-event laid the foundation for how G20 countries should move forward with AMR. The G20 delegate acknowledged the critical importance of AMR and the need for concerted effort across countries, noting that AMR, like any other pandemics, ignores borders. G20 countries also affirm the need to implement a comprehensive, integrated One Health approach to AMR surveillance. Then we had the second pre-event on June 29, 2022, also in a virtual format. The second pre-event specifically discussed the common surveillance targets for integrated One Health surveillance and start small with ESBL producing E. coli and how to improve integrated One Health EMR and antimicrobial use and antimicrobial consumption surveillance. G20 reaffirmed the commitment to support each other in developing, strengthening, and extending national surveillance system. We ended the series of pre-events with the AMR side event on August 24, 2022 in Nusa Dua, Bali. The three event has resulted to a call to action on AMR that emphasizes important points as follows. The first, G20 reaffirms its commitment to lead by example and implement our own AMR National Action Plan across all sectors. Second, G20 calls for member states to address AMR with One Health AMR surveillance implementation and contribute to achieving the SDGs. The collaboration on strengthening surveillance system among G20 countries is very important. Third, G20 calls for commitment to enhance the coverage and quality of diagnosis of infection and resistant infections at all levels of the health system. Fourth, G20 calls upon the United Nations Secretary General and the quadripartite to establish the independent panel on evidence for action against AMR, as recommended by the Interagency Consultative Group with a scope agreed by UN member states. Fifth, G20 calls for strengthened engagement with the Global AMR Research and Development Hub, OECD, the quadripartite, and other international antimicrobial research and development organizations whenever possible and relevant. Six, G20 calls for improved infection disease prevention and control. Seven, G20 calls for the advancement of antimicrobial stewardship as a priority area across the One Health spectrum. Ladies and gentlemen, the burning question for us will be, what are the impact of the G20 AMR side event on Indonesia? Firstly, Indonesia commits to improving the One Health surveillance by accepting the WHO project on AMR periodic nationally representative prevalence surveys. This will improve the Indonesian AMR surveillance system to understand and assess the emergence and spread of AMR and effective pandemic preparedness, prevention, and response efforts. Secondly, Indonesia will strengthen the implementation of 6 strategies in National Action Plan on AMR by improving coordination and collaboration with One Health approach at national, regional, and global level. Ladies and gentlemen, lastly, I wish to extend my highest appreciation to WHO and KPRA, who have shared their invaluable knowledge within the G20 forum, and also the Fleming Fund for its consistent support to all of our discussion in terms of technical and logistical inputs. It is important that we remain committed to pursuing our collective goals based on multilateralism approach. Let's recover together, recover stronger. Thank you. Let me now turn back to the moderator.
Okay, thank you, Mrs. Yani. We will continue to listen the presenting from Dr. Anis.
Thank
Dr.
you.
Anis, you can continue, Doc.
Yeah, so apologize for this low connection. So I want to continue my presentation about the data of Indonesia. We can see here the data from 2019 until 2021 for the gram-negative bacteria that resistant to 3rd generation of cephalosporin is still stable. So there is no significant decrease of the percentage of resistance. And about the fluoroquinolone also show us the same data. And for carbapenem, it is very low still, but also there is still no decrease
Hello, Doc. Maybe you can turn off your camera. I think we lose you again, Doc. Okay. Now we will go to Prof. Hanan.
Can you hear me?
Yeah.
Okay.
Clear, Prof.
Okay, now I will try to upload my slides if that is possible because I was having some issues. Is that possible? Or do we have the first speaker back?
2 minutes is okay, Doc?
Yes, but I need to upload my slide. Is that okay?
Yeah, Prof.
Okay. Can you see my slides? Is it clear, I hope? Okay.
Yeah.
So, okay, great. So apologies for that. And I think the previous presentations gave a great example of how Indonesia is tackling AMR, and that is great. And this is just a quick snap at where is the progress on the national 1.0 national action plans. And this data comes from the TRAC's 5-year response. And as you can see, the highest level of progress, which would be E, is only 32 countries, so 20% of the countries reporting. And many of the other countries are either in C or D, and significant numbers of countries have not even initiated their national action plan. And as I mentioned in my introduction, this is really a phenomena that will require the multi-sectorality. This slide focuses even more on the multi-sectoral working groups within the different countries, and even the progress is even much lower, where most of the countries are in category A or B. So A, which they have no formal multi-sectoral governance or coordination, and B, they do have it, but it is not fully functional. And very few countries have well-established multi-sectoral working groups. I want to emphasize the multi-sectorality here because this is not only important for AMR, but it is important for any of the One Health pathogens. And AMR could be a great example on moving forward at any country with the multi-sectoral communication and collaboration. The WHO has really focused, and we're hoping from the human health sector, looking into the integrated programmatic response on antimicrobial resistance with 6 critical building blocks. Political commitment and governance is crucial. Without the high political commitment and governance, many of the technical teams working on AMR at the healthcare setting are not empowered and are not supported to do the different tasks that are needed. Another glaring deficiency is diagnosis and diagnostics. And as I said in my opening, that will not be doable without universal health coverage, primary health care, access to effective diagnostics, therapeutics, and immunizations. And you can see also the relevance of prevention and control, the supply chain, appropriate treatment, surveillance, and so on and so forth. This is considered one of the progresses that we were able to
Your
yes?
time is 1 minute. Again,
Yes,
Prof.
one more minute, yes.
Yeah.
On the Global Leaders Group activities and the relevance of the antimicrobial resistance in the negotiations of the pandemic accord. And we look forward to the member states taking a look at the release from the Global Leaders Group on the areas where AMR can be incorporated. And with that, my final slide is on the AMR conference in Oman, where they will be discussing targets for antimicrobial use, and we hope to see you all there. These are the asks, and it's similar to what my colleague has mentioned before me, is the funding, the financial support, and supporting the outcomes of the previous IACG, and following through with monitoring the progress. And we're hoping that we can continue to work with all of our member states on progressing with AMR. Thank you very much.
Thank you, Prof. I think we just have only one question. Clear question. You can.
Hi, we have now for questions for Professor
I can't hear, by the way, in case
this is for Professor
I cannot hear anything.
Nggak bisa dengar.
Cek.
Will you repeat the question, or you will put it in the chat?
Yeah, okay.
Hello, Professor Hannah. Can you hear me?
Now I can hear you, yes.
Yes, thank you. In your statement, you said that because the overuse of antibiotics, it's causing resistance. But in some areas, there's lack of distribution for the antibiotics, causing even common illnesses that can be treated with antibiotics.
Yes.
Have WHO found working with groups like G20 assist with cross-border problems of tackling AMR? Have that been proven so far?
Can you explain what you mean by cross-border problems?
Like I said, some is being overusing, assuming is the developed countries, and then there are lacks of antibiotics. So assumption is being made it's in more developing countries. So it sounded like more like a distribution problems. One is being overused, the other one is lack of antibiotics. Working with
Yeah.
G20 is where it's already have an established cooperation, have it help with WHO with tackling AMR itself.
I think, as you had mentioned, and some of the speakers have mentioned, the G20 and the G7 as well, they have major roles in supporting the work on antimicrobial resistance. The complexity, not the complexity, what is unique about AMR is the lack of access and the overuse can be seen in all levels of country income, high, mid, and low. And that's why each country needs to address what are the biggest problems in the access to antimicrobials in some of the underprivileged communities in high-income countries because of lack of insurance. They're not able to access good diagnostics or antibiotics. In low-mid-income countries, the same issue stands, and there are several potential solutions that we are trying to address at WHO and working with partners. One of them is to ensure access to old and new antimicrobials. And we wish that the G20s can also collaborate with the WHO and partners to ensure the supply chain of old and new antimicrobials. Our initial initiative is currently secure with GARD-P, and we're looking into expanding that into old and new antibiotics and diagnostics. So definitely the G20 has a role to play in supporting such initiatives to ensure access and also stewardship and proper use of antibiotics. I hope that addresses your question.
Yeah, thank you, Prof. Maybe we can discuss in the out of this event. Sorry for the limited time. Must end this discussion. Thank you very much. See you in the next press conference. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Prof.
Waalaikumsalam warahmatullah.
Thank you,
Prof.
Dr.
and
Anis.
colleagues.
Mohon maaf, Dok.
Goodbye.
Bye, Prof.